Laboratory workers are staging a lunchtime picket in Johannesburg. The NEHAWU members are unhappy about salary increases and a lack of personal protective equipment. Bringing us live updates now is ENCA's Heidi Giokos. And Heidi, it is midday and we were expecting that there would be activity around the National Health Laboratories Service. What are you seeing at the moment in terms of that lunchtime picket by workers?
Yes, Tulas, we know that the picket started at exactly 12 o'clock. As you can see, people have gathered here, workers at the laboratory service here in Johannesburg. There were only supposed to be 50 of them according to the regulations, but it seems as though there are a little bit more. They are singing and chanting. We didn't get a chance to speak to anyone as yet, as they had just begun, but it seems as though they're having a little meeting at the moment now. But as we know and we do understand that it's about a wage increase that they have been fighting for, according to NEHAWU, as of last year already. And it's also got to do with the fact that they believe they do not have the correct personal protective equipment. They are saying that they are not protected as they are frontline workers during this pandemic. So this is why they've decided to picket between lunch breaks. And NEHAWU yesterday indicated that this picket here at the laboratory service is almost going to be used as a springboard, because they are going to be picketing the whole of next week during lunch breaks, and that's across all sectors in all provinces. And on the 28th of August, it will be a complete stay away from work, as well as the 3rd of September. So they're using this picket here today to demonstrate and perhaps have their voices heard, and maybe their demands will be met by the health department.
So the program of action that they outline into the coming weeks suggests that, in their reading at least, they are nowhere close to any kind of consensus with government on these demands.
Yes, exactly. So yesterday, when we were briefed by NEHAWU, they said that they had meetings with the Health Minister, Dr. William Kiza, on the 13th of August, and they're saying that there were no fruitful conversations and there was no agreement with the Health Department as well as NEHAWU. They are saying that NEHAWU went on a fact-finding mission. They almost went on a tour in a number of hospitals and clinics, and they found that the working conditions were unfavorable, that they did not have adequate PPE for their staff members, and they believe that perhaps if they picket and demonstrate as they are here today, then maybe the department will hear their arguments and meet their demands. So we've tried to reach out to the health department to get a sense of what exactly happened in that conversation, what was their side of the story, and whether or not they have a plan B, because you have workers here who are so essential in the middle of this pandemic. Even though our numbers are dropping, they are still needed. The laboratory services are needed for testing. So they are definitely going to have to come back with some kind of agreement or conversation with NEHAWU, because NEHAWU is saying is that they have no other choice and they are not backing down until their demands are met. And as you can clearly see behind me, they are picketing, they are sticking to what they said they will, their national program of action across all provinces and all sectors.
All right, thank you for that update there. That's ENCA's Heidi Giokos watching the situation at the National Health Laboratories Service, where workers are holding a lunchtime picket. One gets the sense that that's the warning salvo, the opening salvo of that battle by the workers against government in terms of their demands. They have every intention of escalating until their demands are met. Let's see how it plays out.